Hello, and welcome to this training on trauma informed care. My name is Scott Webb, and I'm the Trauma Informed Care Coordinator for the Department of Health Services for the state of Wisconsin. And I'm honored to be able to provide you a quick 20-minute overview on trauma informed care and how you can take those principles and apply them in the work that you do every day. So, what I want to do today before we start this conversation is to just reemphasize that this is a safe place. And I want you to practice some self care. We're going to be talking about some things that could cause some uncomfortable feelings, some stress reactions. And I want you to have permission to do whatever you need to do during this training to take care of yourself. And on that screen, I have some ideas that you can practice. And I would encourage you to take full advantage of all of those. If you need to pause and step away, that's okay. Come back when you feel safe and in control and ready to continue the education. The agenda today, what I'm going to do for the next 20 minutes is talk about trauma. And more importantly, how does trauma affect the brain? As a trauma survivor myself, that really resonated with me when I learned about that and how it affects our brain architecture. So I want to talk about that. Then I want to move into an overview of trauma informed care and way to incorporate the trauma informed ideas, principles into your daily work, s- especially working with patients. And then I want to end with some trauma informed care truths. By way of introduction and definitions, I want to just kind of define our terms. So, one of the things I want to talk about is adversity. You're going to hear a little bit about that today. That often begins in childhood. Those adverse childhood experiences can really affect the course of somebody's life, and usually it can be in very profound and difficult ways. We're going to talk about some generational or historical trauma, which is a trauma shared by a large group of people, a society, if you will. And that trauma that may have happened several decades ago can still be can still be felt by the people today. And then we're going to talk about trauma informed care as a way to respond to those adversities and the generational traumas. It's an organizational approach. It's a type of intervention, a way of being that focuses on how adversity and trauma may affect an individual's life and their response to services. So let's start off by talking about trauma and the neurobiology of trauma. First of all, I like to think of bullet points when I talk about trauma, and I think of trauma as a wound. The Greek word for trauma means wound. And we're very familiar with physical traumas. We can see them and we respond to them accordingly, right? But there's also psychological wounds. And like physical wounds, they need time and the right care for that wound to heal properly. And unfortunately, in our systems of care right now, that doesn't always happen. Trauma is a very subjective experience. It's more about the reaction to an event than the event itself. So, what may be considered a trauma to me may not be considered a trauma to you, and we would respond accordingly. Dr. Judith Herman calls trauma the disease of disconnection, where people who have a trauma history often feel disconnected from their own bodies because they don't want to feel that physical and psychological pain. So they'll numb themselves out in any number of ways, dissociating, cutting on themselves, drinking alcohol, taking drugs. And they also disconnect from other human beings because oftentimes we don't want to share our story, or we feel like if we shared our story, people would reject us. And we've had enough rejection in our life. So we just kind of keep the story to ourselves and we kind of stay these islands of misery. Trauma is about betrayal and desertion, especially psychological trauma. Trauma affects relationships. If you grew up in a family with a lot of domestic violence, your idea of relationship may be warped. It may be affected by what your caretakers, your parents taught you about what relationships should look like. Trauma is anything that can be overwhelming, something that happens too much, too fast, or too soon, or too long. And you couple that with a lack of protection and support, makes that trauma even more painful. Trauma does live in the body. In fact, there's a book by Bessel van der Kolk called The Body Keeps the Score. He goes in a great deal about this, but trauma is stored in the body at the cellular level. The one quote that I've always found very useful is, "Our organs weep the tears our eyes cannot shed." And for me as a trauma survivor, I had an ulcer when I was 16 years old. I suffered a widowmaker heart attack 8 years ago at the age of 56. So this is actually 9 years ago. So this is the fingerprints of trauma in our lives and how it affects our bodies. And the other quote that I've heard is, "Our issues live in our tissues." There's different types of trauma. They're not all the same. Acute trauma would be a type of trauma that happens mainly to adults, but not always. And it's a single event trauma. There's a beginning and a middle and end to the event. It's contained. So that trauma, people can bounce back from that rather quickly if they have good psychological makeup and a good support system around them. Complex trauma is very different because this is a trauma that usually affects small children, very small children, and vulnerable adults. So there's a real power differential between the person who is doing the traumatizing and the person being victimized by the trauma. And that complex trauma can lead to very complex clinical issues later in life because it happens at such a young age. It's not a single event trauma, it can go on for months or even years. Historical trauma, I just touched on briefly when I talked about generational trauma. That's a trauma that's been felt by a certain group of people. We think of American chattel slavery, we think of the violent colonization of indigenous Native Americans, we think of Holocaust survivors. Those types of traumas can leave a very, very, very powerful imprint on that society, and we can see young people today being affected by traumas that were perpetrated on those people, 60, 70, 100, 200 years ago. Sanctuary trauma is a trauma that happens in a place where you should feel safe, your sanctuary, like your home, foster care, seeking medical care services or psychological services, all those places you should feel safe. And if you're being wounded in those sanctuaries, in your sanctuary, by people entrusted to keep you safe, then it makes sense that we're going to have a difficult time feeling safe with anybody or trust anybody. And those are two big hallmarks of traumatized people is a lack of trust and then of not feeling safe. Vicarious trauma is a trauma that all of us in helping professions experience because we are deep feelers. We have a lot of empathy. And when we're being wounded by the work that we do, we care deeply for people. We hear these stories of people's pain over and over again. We can begin to vicariously join them in that pain and find ourselves experiencing post-traumatic stress symptoms very, very similar to the clients that we are working with or the patients that we work with. And then collective trauma would be a trauma that really affects entire groups, societies of people, even bigger than historical trauma. We're talking about the pandemic, which affected the entire world. We're thinking about the community violence that was going on in 2020 in the wake of the George Floyd situation. So that collective trauma can really affect us on top of all the other traumas that we experience. And then there's those activating experiences. We used to call them triggers. I'm trying to move away from that word, but those things, those experiences that will activate our brains to go into fight, flight, or freeze. And if we're always put into those situations, we can actually change our brain chemistry and our brains will change in that we're always looking for danger instead of looking for connection. This is not an exhaustive list, and I don't have time to go through these in any great detail, but just think about how you in your day-to-day work may be doing some of these things with with your colleagues or your patients or whoever you work with. And we may be inadvertently re-traumatizing people and activating their limbic brain because of the way we talk to them or what we do and how we position ourselves in a room, things like that. So trauma does disrupt the way the brain is developed. Let's just take an example. We have a child that is in a very chaotic, highly stressed living situation, and they're constantly going into fight, flight, or freeze. The body becomes overwhelmed by these powerful chemicals, these powerful hormones. And over time, if that chaos does not abate, and we don't have well-regulated adults around these children, that their brains will begin to get wired to look for danger rather than connection. They get stuck in this stress response mode where they're living in a constant state of fear and terror. And so any cues, anything that would remind them of that original trauma is going to activate their brains and put them into a fight, flight, or freeze situation. So they'll live in this constant state of fear. And this PET scan of a child's brain, two different children, show you the difference of what trauma can do to the human brain. The brain on the left is a healthy brain of a child. You see, it's very, very well lit up with a lot of red, yellows, greens. That's good. That's a good thing. The brain on the right of a Romanian orphan, and that brain is very dark because the neurons in that brain have died off. Those neurons that look for connection and feeling safe and loved, those die off. The neurons that look for danger and responding to danger get strengthened and strengthened and strengthened. So you have a brain now that's wired to look for danger rather than connection. So because of that, we need to look at trauma informed care. And what we do with this trauma informed care idea is just like Dr. Hoda says here, we need to presume that the clients we work with, the patients that we serve, let's just assume that all of them have a very, very significant trauma history. And let's just exercise universal precautions by just treating them that way and coming to them with care, empathy, gentleness, safety. That's what we want to do. And be always mindful of how we are interacting and how we come across when we're dealing with people, especially those who come from trauma. And if we were to be honest, a lot of trauma is a lot more prevalent than we ever thought. So being trauma informed is about putting on different lenses over your eyes and looking at yourself, your organization, and the work that you do in a very different way. It's a paradigm shift. And we have to look in the mirror too. We have to look at our own situation. Do we come from trauma ourselves? Have we done our own trauma work? Have we done our digging in the dirt, as I like to say, and actually maybe seeking out help, professional help to deal with our own trauma history? I certainly had to do that in my situation so that I didn't recreate the trauma that I experienced as a child. So we have to look in the mirror and see where we're at. Are we ready to provide trauma informed services? So being trauma informed, it's not a thing that you do. It's really how you do your thing. So it's not something you take off the shelf and use. It's really how you actually employ it. And it's all about relationship building. It's about creating safety, establishing rapport with people. Even in those short times you might be with a patient, those moments can be very powerful if you are mindful of being trauma sensitive. It's about forming some really healthy connections. Motivational interviewing is a really great way to connect with people. And if you've ever had training in that, that's a great micro skill that fits within a trauma informed system. It's about self care for yourself and teaching other people how to self regulate if they're constantly going into fight, flight, or freeze. It's about having a healthy peer to peer interaction and teaching, being a teacher, teaching people how to regulate themselves and teaching the link between trauma and mental health, substance use disorders, and even physical issues. I have advanced heart disease, and I believe it is directly related to my chaotic childhood. I really believe there's a connection there. So trauma informed care is about just acknowledging that trauma is very pervasive. It focuses on how trauma may affect a person's life and how they may respond to you and to services that you're trying to provide. It's about trying to create safety for everybody. Being trauma informed isn't just what you do for the patient, it's what you do for each other. For leadership, how you treat your staff, building that atmosphere of trust, having that compassionate collaboration, being strength based, and doing what you can as much as you can to avoid re-traumatizing people and having going to those activating experiences. Are we going to get it right every time? Absolutely not. But we're mindful, we're aware of, and we're always looking in the mirror and thinking, what could I do differently to make this a more safe situation? And now we also want to talk about striving to maximize choice for the survivor and control over the healing process. It seeks to be culturally competent. So there's six trauma informed care principles that we need to be thinking about. We have to talk about safety, trustworthiness, transparency, peer support, collaboration, mutuality, empowerment, voice, choice, and cultural, historical, gender issues. And I'm going to take some examples later on here and show you how those line up. But these are the six principles that I think are the most important in how we deal with people and in our doing our day to day work. So, ways to do it. Let's take a patient from entrance to the clinic into meeting with a provider, the exam. Having clear signage that creates a warm and welcoming atmosphere. So people come in, they feel like they're welcome. It doesn't look institutional. It looks like, hey, we want you to be here, and people will feel safe. And there's real transparency about what you're about. Giving giving patients the choice of telling you their information, or giving you or asking for a photo ID for check-in. Taking note of preferences of what the patient likes to be called. Being culturally aware, sensitive, have gender respect. When it comes to a procedure, explaining each step why and give as many choices as possible, and also letting the patient have permission to stop anything they don't feel comfortable with, giving them the power and the choice to do that. Don't position yourself between yourself and the door if you can help it, because some traumatized people will feel a sense of being trapped if somebody's blocking their way to get out, because it may be a recreation of their childhood, right? Sitting at eye level with the patient to discuss their situation, and you're really kind of demonstrating a leveling of power dynamics. You're not standing over them, you're with them. It creates that trustworthiness and safety. Let the patient know that they can ask questions. Give them that voice, give them choice. They can stop the procedure at any time. Ask explicit information, permission, before you touch the patient or give a procedure. That's creating safety, trust, empowerment. So you can see how those principles can be folded into your just your exam situation, even coming in from the front door. Again, you want to focus on if you notice any discomfort with a patient, ask questions. Do you experience any discomfort when having a procedure like this? You seem very uncomfortable right now. You're tuning into them. Is there anything I need to know right now about your situation to make this easier for you? Listening, not judging. It's really important that we don't judge people because they're putting a lot of trust in you, and we don't want to be judging because when we judge people, we lose the ability to connect with them. Don't give advice. Well, ask the person if there's anything that you can do to help them, like I mentioned before. Don't share someone else's story or someone else's or your story at this time. It's not about you, it's about them. Try not to ask too many questions because it feels like you don't believe them and it feels like an interrogation. So you want to have a conversation, not an interrogation, and really working to keep your own emotions in check because traumatized people are very sensitive, can read the room, they're very perceptive. Being aware of your body language, complete medical history prior to taking the patients to remove clothing, encouraging them to answer specific questions, make that and feel them uncomfortable. You want to reduce appointment stress by doing some of these things. Reminding patients that consent can be removed at any time. These are really important things to consider. Using less provocative language. Instead of saying undress, say change. Instead of saying bed, say exam table, because those words can be those trigger words that can get people very uncomfortable. Instead of saying panties, say underwear. Allow the patient again to have permission and power and control over the situation. They can stop the exam at any time. And certain procedures can promote strong reactions. Invasive procedures, opening the mouth, removal of clothing, touch, procedures that involve touching with an instrument or a device can inadvertently recreate the trauma experience for some people. So, if you're being aware that certain procedures can promote strong reactions, that's a half the half the situation, half the battle right there, and not the battle, but it's half of, being trauma informed and trauma sensitive. Just focusing only on bodily pain, not announcing a procedure, minimizing patient fears. Those things only build anxiety and fear. So what do you do if a consumer client becomes emotional telling their trauma story? You can say, "How can I support you right now? I don't have the words, but how can I support you? What do you need?" If the patient's trauma story leaves you overwhelmed and speechless, if they share something that's very, very hard for you to hear, can you be strong enough to sit with that person in supportive silence? Have you done your own trauma work, digging in the dirt? If you haven't, then you probably should think about doing that because that will strengthen you to be able to bear witness to other people's pain and hear their stories and not get triggered yourself and move into fight, flight, or freeze yourself. If a patient seems confused by the information you're giving them, be patient with them. Use simple, clear words regarding the when, where, and by whom services will be provided. Be prepared to repeat information many times because if my limbic brain is activated, the part of my brain that would take in the information and make sense of it is offline. That happens to all of us. It happens automatically. So we need to be aware of that and just be mindful and maybe help them calm down, do some deep breathing, and then make sure that they understand the words. You have to repeat it many times sometimes for them to get it. Some trauma informed care truths. I'm not going to go into great detail here, but I just want you to know that there is no magic formula for trauma informed care. There is no single way that you can become trauma informed. Like I can give you this recipe book and you follow all the steps and you come to the trauma informed, you become a trauma informed clinic. Every clinic that has made this journey has taken a different path, but they all end up kind of in the same place. So I have some questions to consider. You can have those, you can look at those and you can have those conversations within your own place of work. Another truth, it requires trauma-informed care requires that we move away from this us versus them thing and think about that we're all in this together. That's what I love about trauma-informed care. It's not about the patient necessarily. It's about all of us because we can't give what we don't have. If we're not a trauma-informed clinic and taking care and using those six principles ourselves, so we can't really move that to the patient experience because we're not there. We can't give what we don't have. So we need to think about, that we're all in this together. And going to one trauma-informed care training does not make you or an organization trauma-informed, and that's a big myth that a lot of people seem to have if they have a training. If I come in to do my 4-hour training for you, that you're gonna walk away saying, "Yep, we're trauma-informed, we're good to go." No, you're not. This takes a long time, several years. There's trauma has a multi-layered impact on people and communities and systems. It's very complex, so it takes time to work through all this and to adopt this, implement it in a way that's meaningful. So my final thought for you today is that every life is a piece of art put together with all means available. Every trauma survivor is broken. There's pieces missing, but if we can become trauma informed as a practitioner, as an organization, as a people, we can help those who have suffered serious traumas find those missing pieces to be that beautiful work of art that they're always meant to be. And I can think of people that I know who I respect for who are trauma survivors who are amazing. And their stories, you'd think, how do they even survive it? But they're thriving and doing great things today. So the other way I like to think of this is kintsugi, which is an ancient Japanese art of repairing broken pottery with gold. Again, I think of trauma survivors as broken vessels, but when we put them back together with gold, that could be us being trauma informed systems. We are that gold. Actually, it's a more beautiful vessel in its repaired state than in its original state. And I think that speaks to all of us as trauma survivors. I do have some resources I'm going to call your attention to. You can look at these whenever you want to. Some books on trauma, trauma informed care, trauma therapy, self care, psychological safety in the workplace, which is a part of trauma informed workplaces. I have some videos for you to look at on trauma and grief, trauma informed care, on resilience, and compassion fatigue and self care. So I think I covered everything in all of that. So I give you permission to do that. This is my contact information if you wish to reach out to me either through my website, through my email at DHS or my LinkedIn page. And I want to thank you all for this opportunity to present this training on trauma informed care.